Welcome to Dr. CM Edcast, your go-to resource for medical learning. Through discussions, case studies, tutorials, and debates, we help you learn, grow, serve.
Every single moment of our lives, we're turning thoughts into actions, reaching for a book, taking a step, even just a tiny shift in posture. And behind this whole process, which seems so effortless, there's this deeply complex, really elegant system, kind of like a hidden conductor, orchestrating our every move. So today, we're going to pull back the curtain on this system, the basal ganglia.
It's a pretty profound question when you stop and think about it. How does that simple idea, I want to pick up my coffee, turn into a smooth, coordinated reach and grasp? Well, the answer, as we're about to see, isn't really about what starts the movement, but what refines it. And that's a huge distinction, and it completely changes how we think about motor control. So the basal ganglia aren't just one single thing. They're actually a collection of interconnected nuclei buried deep inside the brain. And you shouldn't think of them as the engine of movement, but more like the really sophisticated guidance system. So while the cortex, kind of the brain's CEO, decides what to do, it's the basal ganglia that fine-tune that command to make sure our actions are smooth, purposeful, and precise. Okay, so to really understand how this conductor works, we first need to meet the orchestra, right? We're going to start by mapping out the key anatomical structures that actually make up the basal ganglia. All right, so the primary receiving station for all this information is something called the corpus striatum. Or, we can just call it the striatum. Think of it like the main inbox. It gets a massive amount of input, mostly from the cerebral cortex. That's the part of our brain responsible for all the higher thought and planning. And this diagram here breaks that striatum down into its two key parts. You've got the C-shaped caudate nucleus, and right next to it, the putamen. Now, even though they're distinct structures, functionally, they pretty much operate as one big critical input station, just receiving and sorting all those initial commands coming down from the cortex. Now, beyond that main inbox, there are three other structures that are absolutely vital. First, the globus pallidus. This acts as the main output channel, sending the refined signals on their way. Then there's the substantia nigra. This is kind of like the system's chemist. It produces the supercritical neurotransmitter dopamine, which, as we'll see, is essential for modulating the entire circuit. And finally, the subthalamic nucleus acts as a key internal checkpoint, helping to regulate the flow of information. So together, these guys form the core of the whole processing unit. So now that we've met all the players, let's see how they actually work together. The real elegance of the basal ganglia isn't in the individual parts, but in the incredibly intricate functional loops they form. Check this out. This diagram shows the fundamental circuit that's right at the heart of the basal ganglia's function. Just follow the flow. It goes from the cortex, through the basal ganglia, over to the thalamus, and then, and this is the critical part, right back to the cortex. This is not a one-way street. This loop provides this powerful negative feedback, acting like a brake or a filter. It doesn't start the movement, it is constantly refining and controlling what the motor cortex is doing.
So here's the bottom line, the crucial point. The cortex might shout a general command, something like, move arm. The basal ganglia then step in like a gatekeeper. It refines that command, picking out the exact right motor program to get the movement done smoothly, while at the very same time it's inhibiting all the other competing, unwanted movements you don't want to make.
Okay, so let's zoom in on that main feedback system for a second. It's not just one single loop. It's actually two parallel circuits, and they each have very distinct jobs. You have the caudate loop, which is all about the cognitive planning of movement, and then you have the putamen loop, which is focused on the actual execution of those plans. And this just illustrates the difference perfectly. The caudate loop, it gets its input from the brain's association areas, the planning centers. It helps you form the idea of the movement. The putamen loop, on the other hand, gets its input from the motor cortex itself, and it's responsible for executing the learned patterns of movement, like the actual physical act of reaching for that cup. Pretty cool, right? The incredible importance of this system becomes just so starkly clear when these finely tuned circuits get disrupted. Any damage or imbalance within the basal ganglia can lead to some really devastating movement disorders. And perhaps the most well-known of all of these is Parkinson's disease. At its core, this is a disease of the basal ganglia. What causes it is the progressive loss of those critical dopamine-producing neurons back in the substantia nigra, and that just throws the entire system into complete disarray. This diagram just shows it all. On the left, you see the healthy state. Everything's in perfect balance. But now follow the pathways on the right in the Parkinsonian state. The loss of dopamine causes the inhibitory signals from the basal ganglia to just become overwhelming. This overactive inhibition completely suppresses the motor cortex. To put it simply, the system is slamming the brakes on movement way too hard. And this circuit imbalance is exactly what shows up as the classic symptoms. Akinesia, that difficulty in just starting a movement, is a direct result of that excessive braking signal. Rigidity is that increase in muscle tone you feel through the whole range of motion. And of course, tremors, the involuntary shaking that happens, especially when the body is at rest. Now, it's really important to distinguish the rigidity you see in Parkinson's from something called spasticity, which comes from damage to totally different pathways. As this table shows, rigidity affects all the muscles around a joint, creating this constant lead pipe feeling, whereas spasticity is more velocity dependent. It often has what they call a clasp knife quality. And that distinction is absolutely key for clinical diagnosis. So, Parkinson's is a hypokinetic disorder. Hypo, meaning too little movement. But the basal ganglia can fail in the exact opposite way, leading to hyperkinetic disorders like Huntington's disease or hemibolism. In those cases, the problem is not enough inhibition, which leads to a flood of unwanted, involuntary, often flailing movements. They're really just two sides of the exact same coin of circuit imbalance. So as we've seen, the basal ganglia is so much more than a simple motor structure. It really is a master modulator, a gatekeeper that sits right at the crossroads of our intentions and our actions. It's what allows us to perform the right movements at the right time with just the right amount of force, all while suppressing everything else. Ultimately, the basal ganglia show us how an intention gets sculpted into a reality. And this incredible system, it just leaves us with this compelling thought. If these deep brain circuits are the arbiters of our physical actions, well, what other circuits are in there, quietly shaping our thoughts, our emotions, our very experience of the world, just waiting to be understood?